Hi, good afternoon. My name is Maimuna. I'm a student nurse from South Florida State College. I'm just here to do a head to toe assessment on you. I'm gonna put my stuff down, put my barrier down. Okay. I'm gonna write my name on the board to give you a visual of what it looks like. Can you tell me your first and last name? Can you tell me your date of birth? Do you have any allergies? Okay. Do you have any allergies specific to latex as well? No. I'm going to check the environment, make sure that it's clean, make sure there's no water around the patient because he's on a fluid restriction diet. I'm going to make sure that the bed is at the slowest position, bed rails are up. I'm going to bump the bed to make sure that it's locked. Bump, bump, bed is locked. Is there anything you need before we continue? No? Okay. I'm going to raise the bed to the best working appropriate height for me. I can assure you I already cleaned my equipment. I'm going to take some vitals. Have you had any breast or chest surgery in your upper arms? Have you had any accidents in your upper arms? I'm going to check for circulation, dialysis, no edema in the upper arms. IVs on the right side, so I'm going to take the blood pressure on the left side. I'm going to clean my stethoscope again to be sure. Blood pressure is 92/68. I'm going to proceed to listen to your apical pulse, okay? For 1 minute, apical pulse is 111. Listen to your respirations. Respirations 21. I'm going to take your temperature. Have you had anything hot or cold to drink? Okay. No. Temperature is 99.1. O2 sat, make sure capillary refill less than 3 seconds, and no nail polish on the patient's nail bed. Capillary refill, O2 sat is 97%. Are you experiencing any numbness or tingling throughout your body? Are you in any pain right now? Can you tell me when the pain started? Can you tell me where the pain is? Can you tell me how long the pain lasts? Is it constant or intermittent? Can you describe it? Is it chronic? Is it sharp? What makes it worse? What makes it feel better? Are you taking any treatment at the moment? Can you rate the severity of it for me on a scale of 0 to 10, 0 being the least painful, 10 being the most painful? How would you rate it? A 4? Would you like me to stop and get the nurse? All right. So I'm going to continue on, move on to the lines. I'm going to check the IV gauge side, which should be 20 gauge saline lock. On that side. I'm going to check the IV gauge side, 20 gauge saline lock. 20 gauge IV, sorry. I'm going to check the dressing, make sure that it's intact. No redness, no swelling, no warmth. Does it hurt when I do that? I'm going to check the clamp to make sure that it's closed for saline lock and open for continuous IV fluids. I'm going to check the tubing, no kinks, no air bubbles, and the drip chamber is half full. I'm going to check the fluid type, the clarity of it, expiration date, amount remaining, and at what rate it's infusing at. If it's hanging for more than 24 hours at this time, I would stop and go get the nurse and inform the nurse. Then I'll move on to the nasal cannula. Make sure that the prongs are down, no redness or irritation on the cheeks and behind the ears. The tubing isn't kinked and it's added to the fluoride. If my hands are infested at this point, I would change to my gloves and put on a new pair of gloves. Then I'll move on to the Foley. I'll check the size, which should be 16 Foley French. Make sure that it's secured to either the left or right side. If it's not, I will secure it unless stated otherwise. I'll check the tubing for clarity and color. I'll check the amount, which should be 200 in the bag. Make sure that it's hanging on the bed frame instead of the bed rail. And at this point, I would change my gloves and put on a new pair of gloves. Now I'm going to move on to neuro. Can you tell me where you are? Can you tell me the date? Okay. I'm going to check your pupil gate. I'm going to check your pupil size, okay? 4, 5. So I'm going to flash a little bit of light into your eyes. Look at my nose, okay? Okay. Patient's right eye is not reactive to light. Can you smile for me? Yes. Okay. Can you stick your tongue out? Mucus pink and moist. Can you swallow? Okay. All right. Swallow for me. All right. Skin toger, less than 3 seconds. No breakdown present. And tongue at midline. Face is symmetrical. Heart rate is irregular. So I'm gonna proceed to listen to your lungs, but prior to that, can you tell me if you have a cough? Yes. Okay. Are you experiencing shortness of breath? You have difficulty breathing. Can you describe the sputum for me? A thick green sputum. So I'm gonna listen to your lungs to make sure to check what's going on. I'm gonna clean my stethoscope. As I move the bell of the stethoscope, can you please breathe in and out for me? In and out. Deep breaths. All right, at this time, I'm going to have you turn over if you can, okay? With the help of another nurse or a student nurse, I'll turn the patient over. All right, 1, 2, 3. While assessing the back for any breakdown, breathe in and out for me. Okay. Given that the patient has right side pain, I would have the patient turn towards me, but I can't go on this side. That's why I have the patient turn that side, or have them sit up. Okay. Patient has crackles in both lungs. So I'm going to move on to your abdomen. I'm going to inspect it. Then I'm going to listen to your abdomen. Clean my stethoscope. Right. If I don't hear anything in a quadrant, I would wait for 5 minutes. And if it still proceeds, I would let the nurse know. All right. So I'm just going to palpate your abdomen. Let me know if you're experiencing any pain, okay? While looking at the patient's facial expression. Can you tell me when your last bowel movement was? Can you tell me that? Can you describe the color for me? Can you tell me the consistency? Was it a lot? Was it normal for you? And when was the last time you passed gas? So I'm going to have you squeeze my fingers, okay? Squeeze, squeeze, squeeze. All right. Have you push up, push down. I'm going to check the color. Capillary refill present bilaterally. Pulse present bilaterally. Temperature warm and no edema in upper extremities. And I'm going to move on to your knees. Push up, push down. Okay. And I'm going to move on to your feet. Push up for me. Okay. Push up. Push down. Okay. I'm going to look at the color. Capillary refill on the toe. Okay. I'm going to look for make sure that the pulse are present, pedal pulse present, and posterior tibialis present but weak. It's a little faint. Patient has edema on both legs, and temperature is a little bit cool. Okay. Heel, apart from the big toe, is intact, and throughout the body as well. The skin is intact. I'm just going to check how much pitting you have, okay? Okay. plus 2 fitting on bilaterally. Patient has limited range of motion on right side. Nurse has the nurse previously has a gauge, 2x2 gauge on the wound, and there is sanguineous drainage. So I'm going to take my marker and initial it and circle how much drainage there is right now, so that if there's more present later, they would know how much drainage there was. Okay. So make sure I have everything. Just bear with me. Let me just double check. So I marked the wound. Check everything. Okay. All right. So this time I would change my gloves and put on a new pair of gloves. As I'm lowering the bed, is there anything you need at this time? No? Okay. So bring the call bell right here. I would assess the environment again, make sure that there's no water canisters anywhere for the patient. Make sure that the environment is clean. I will be visiting you every hour, but if you need me in between that, just press the call bell and I'll be here for you, okay? All right. So I would clean my equipment at this time, and I would head off to the donning process. Thank you so much for letting me participate in your care. Would you like the door open or closed? Closed? Okay. I forgot to bring the patient's tray table close, so I'll bring the patient's belongings close by. And thank you so much again for letting me participate in your care. I'll be back in an hour to check on you.